Welcome to the Deep Dive. Today we're tackling a topic that, well, it impacts pretty much everyone over 18, enhancing sexual performance and health.
Yeah, it's definitely a universal concern, isn't it?
It really is. And our mission in this deep dive is to really understand what's happening physiologically,
Hmm.
behind erections, both penile and clitoral.
And pull out some actionable steps for improvement.
Exactly.
Yeah.
All based on this really informative text we've been digging through.
Right. There's some fascinating science here, and the goal is to translate that into, well, practical knowledge you can actually use.
Think of it as a user's guide, maybe,
Yeah,
grounded in how your body works.
precisely.
Okay, so let's unpack this. The foundation seems to be understanding the actual mechanics of arousal.
Hmm.
Our source breaks down erection, and stresses, this includes clitoral erection too, into basically three key steps.
Okay.
First, the nervous system gets activated. Second, blood flow ramps up dramatically to the genitals. Arteries dilate, filling up those corpora cavernosa tissues.
Like sponges, essentially.
Yeah, exactly, like sponges filling with blood. And third, and this seems crucial, that blood needs to stay there to maintain the erection.
Right. The inflow and outflow balance.
What's interesting, though, is the trigger. We usually think sexual stimulation, obviously.
But the document points out that's not the only way it happens. The body's complex. Other things can set this off.
Which leads us straight into the nervous system's role. Our source really focuses on the autonomic nervous system, the automatic part.
Right. The stuff that runs in the background. Sympathetic and parasympathetic.
Yeah, sympathetic for fight or flight, parasympathetic for, well, rest, digest,
And reproduce. That's the key one for us today. That includes erections.
precisely. So for an erection to actually happen, there needs to be a shift. Parasympathetic takes the lead.
Which means the sympathetic system, the stress response, kind of needs to take a back seat.
Yeah, it needs to calm down. The source uses this idea, like you can't inflate a tire if you're letting air out at the same time.
That's a good analogy. It won't be very effective. So a key insight is shifting out of stress mode into rest and digest.
And that letting air out, that's things like stress, anxiety,
Mm,
even stimulants like certain drugs or amphetamines.
exactly. The source really emphasizes how these crank up sympathetic activity boost cortisol.
Making it much harder to get an erection. And it gets interesting here because high sympathetic activity isn't just about getting erect.
No, it can also show up as like low sexual desire or needing way more stimulation than usual.
Does that sound familiar to anyone?
It-
I bet it does.
So the big question is, what can you actually do about it?
Right, the practical steps. The document offers some good tips for taming that sympathetic system. Things like meditation.
Meditation, yeah. Getting enough good quality sleep.
Oh.
Even specific techniques for activating the vagus nerve.
Which the source apparently mentioned in other places.
Mm-hmm.
But there's a potential snag, isn't there? The energy thing.
Ah, yes. Sometimes you finally do relax in the evening, reduce that sympathetic drive.
And instead of feeling aroused, you just feel sleepy.
Happens all the time. It really highlights the importance of timing.
So be strategic. Choose moments when stress is lower. Maybe energy is higher.
Like afternoons, weekends maybe.
Yeah.
Mornings if they aren't too hectic.
And if nighttime's really the only option, but you're wiped out, the source had that little tip.
Yeah, consider having intercourse before dinner. Catch that window before the evening fatigue really hits.
Makes sense. It also briefly touches on somatic nerves, touch, sensation, how that plays a role too. It's a whole body thing.
Absolutely. Now let's pivot to blood flow because that's obviously critical.
Okay.
The document explains that when that parasympathetic system is active, it causes a decrease in intracellular calcium.
Okay. Getting a bit technical.
Yeah, basically less calcium inside the smooth muscle cells lets them relax. That happens in the arteries supplying the genitals and in the spongy tissues themselves, the corpora cavernosa or clitoris.
And this relaxation isn't minor, right?
Mm.
The source puts numbers on it.
Oh yeah. Blood flow can increase 20 to 40 times in men. It's a huge surge. Maybe slightly less dramatic in women, but still very significant.
Wow, 20 to 40 times. But here's the link to general health. If blood flow is already restricted, like poor vascular health.
Like atherosclerosis, yeah, hardened, narrow blood vessels, they just can't relax and open up properly.
So that massive increase, it just can't happen efficiently.
Exactly. The result, delayed erections or erections that aren't as firm or complete.
The source also mentions something interesting about the corpora cavernosa adapting. They can expand.
Yeah, they adapt to the incoming blood volume. And for a good, firm erection, The pressure inside needs to get pretty high, at least 100 millimeters of mercury.
And the corpus spongiosum, the part around the urethra, that's lower pressure.
About a third of that, which is why it stays a bit softer, typically.
And what creates that high pressure, that firmness?
That's where the tunica albuginea comes in. It's this tough, fibrous layer surrounding those chambers. It's not very stretchy. So as blood fills the chambers, they push outwards. But the tunica resists, forcing the pressure inside to build up. That creates the rigidity.
Okay, now for something I honestly wouldn't have immediately connected. The bladder and rectum.
Yeah, it seems surprising, but anatomically it makes sense. The source explains their position in the pelvis.
The bladder's above the prostate, rectum's behind it, and the base of the penis.
So when they're full, they just take up more space. Physical space.
And that space is needed for
the increased blood flow. When you're aroused, that area needs to accommodate a lot more blood heading to the penis or clitoris. If the bladder or rectum are distended, they create physical resistance.
Okay, so it makes it harder for the arteries to deliver the blood.
Exactly. Think about constipation, for example. A full rectum can actually press on those crucial arteries.
So you might still get an erection, but it could take longer or maybe not be as firm.
Or require more stimulation, yeah. And it can also impede the contraction of certain muscles needed to sustain the erection. We'll get to those muscles.
Yeah, fascinating. So practical takeaways here. Empty the tank, basically.
Pretty much. Empty the bladder fully. The source even suggests sitting down to urinate might help get it emptier. Maybe some pelvic movements for residual urine.
Okay. And number 2.
Empty the rectum before sex. Makes sense, right?
That's fully.
And if constipation is an issue, the advice is pretty standard but important. More insoluble fiber.
The bulky stuff.
Right. Maybe cut back on constipating foods like dairy, try abdominal breathing, elevate your knees when you go. The squatting position helps.
And avoid straining too much.
Yeah. And remember, constipation isn't just diet. It involves gut bacteria, the nervous system. It's all connected. Addressing the root cause helps everything.
Okay, so let's synthesize this. Actionable steps for improved sexual function based on what we've covered.
Right. The source gives a nice, concise list. First, stay hydrated. Good blood volume is important.
Makes sense. Second, boost aerobic capacity. High-intensity interval training.
Yeah, but it clarifies, not necessarily killer, HIID. Could be 10, 15 minutes of higher intensity with longer rests, or longer sessions with varied intensity, just improving how your body handles that increased blood flow demand.
Okay. Third, avoid that internal pressure, gas, bloating, constipation, full bladder.
Manage those things. And fourth, support blood vessel relaxation. Make sure you've got enough magnesium, potassium, zinc.
And nitric oxide, which you said we'd come back to.
We will. It's key.
So getting blood in is one thing, but keeping it there, that's the other half.
Exactly. And the body has clever ways. When those corpora cavernosa expand, that tunica albuginea layer we mentioned, it presses on the veins that drain the blood out, creates a bottleneck. So the fuller the chambers, the harder it is for blood to leave.
Like pinching a hose.
Kinda, yeah. But muscles play a huge role, too. The document highlights 2 crucial ones, ischiocavernosus and bulbocavernosus, or bulbospongiosis, sometimes called that.
Right. So the ischiocavernosus, that's a big one for maintaining the erection.
Yeah, its position at the base of the penis means it can directly squeeze those veins shut. Think of it like a built-in clamp.
So stronger muscle, better clamping action.
Better ability to sustain the erection, essentially.
And the other one, bulbocavernosus or bulbospongiosis?
It helps a bit initially, directing blood to the corpus spongiosum, but its old name gives a clue. Accelerator of urine and semen.
So it helps push out the last drops. And the semen during ejaculation.
Exactly. And in women, it helps contract the vaginal opening.
So during sex, these muscles work harder.
They contract more intensely, yeah. That leads to that really rigid phase, pushing pressure even higher in the corpora cavernosa.
And if these muscles are weak, the source mentions signs.
Yeah. Things like difficulty getting that final stage of rigidity, the tip might feel softer, or the erection fading quickly without constant stimulation, or even with mild physical effort.
Okay, so that points towards training them. Kegels?
Kegels, yeah. For everyone. The basic idea is contract the pelvic floor like stopping gas hold for 3 seconds.
Rest for 4 or 5 seconds.
Repeat about 12 times daily. And you can gradually increase the hold time.
And for women, those weighted cones can help.
Yeah, they provide resistance, make it more effective. The goal is just keeping the cone from slipping out.
And the payoff is better sex for both partners.
Absolutely. More satisfying, better performance.
The source also mentions something called the deer exercise from Qigong.
Briefly, yeah, for men. It notes the scientific evidence is limited, but there are positive anecdotal reports. Instructions are apparently in the description.
Okay. And then there are those high-tech machines.
Electromagnetic muscle training, like thousands of Kegels in one session, supposedly.
Wow. Okay, let's shift to things that can cause problems. Poor erections. What is the source list?
Quite a few things. Depression is mentioned, affecting desire, neurotransmitters. More emotional connection there often.
Alcohol.
Yeah, tricky one. A tiny bit might help if stress is high by calming the sympathetic system.
But it's a very fine line.
Very. Too much inhibits the neurotransmitters you need for the actual erection process.
Obesity's on the list too. Makes sense. Cardiovascular health, blood flow issues.
Right. Same with high cholesterol, atherosclerosis, that hardening of the arteries again, restricts dilation.
Nerve damage is another one. Disrupts the signals. Can be a side effect of prostate cancer treatment.
It can be, yeah. And prostate cancer itself can affect erections even without surgery.
Medications too.
Certain ones, yeah. Some antidepressants, psychiatric drugs, even common things like antihistamines. And finasteride, used for hair loss.
And beyond those.
Diabetes, low testosterone, which affects both men and women age, certain muscle disorders.
And performance anxiety, especially in younger guys.
Often linked back to that excessive sympathetic activation we talked about, so those relaxation techniques could be really key there.
Okay, so if natural methods aren't cutting it, pills like sildenafil,
Right, Viagra and similar drugs, they're PDE5 inhibitors.
CD5, that's the enzyme that breaks down.
Cyclic GMP, that's the molecule that helps keep arteries relaxed and dilated. So these drugs stop PDE5 from breaking it down.
Meaning cyclic GMP levels stay higher, arteries stay dilated longer, more blood flow.
Exactly. But, and this is crucial, they only help the plumbing. You still need sexual stimulation. They don't create desire.
Right. They facilitate the response. They don't initiate it.
Precisely. And even if you use them, the source notes that training those pelvic floor muscles is still helpful for trapping the blood.
So the overall advice is optimize everything else first.
Definitely. Lifestyle, stress, diet, exercise, muscle training.
Yeah.
Address all that before jumping to medication if possible.
Okay, let's circle back to nitric oxide. You said it was key.
It really is. The document identifies it as the main vasodilator in erection, the trigger for that cyclic GMP accumulation.
Vasodilator means it widens blood vessels.
Relaxes and widens them, yeah. And it's also seen as a neurotransmitter in this whole process now.
So low nitric oxide could be a problem.
Linked to things like hypertension and erectile dysfunction, yes.
How do we boost it then? Diet?
Yeah, nitrate-rich foods help. Your body converts nitrates to nitric oxide. It beets, celery, spinach.
Okay. And antioxidants.
Like glutathione, vitamin C. They help protect nitric oxide from breaking down too quickly.
Supplements. You mentioned L-citrulline.
Yeah, L-arginine is the direct precursor, but studies are mixed. L-citrulline seems better at actually boosting arginine and nitric oxide levels in the body.
And that surprising tip about mouthwash.
Right. Avoid it. Beneficial bacteria in your mouth are actually part of that nitrate to nitric oxide conversion pathway. Kill them off, and you might reduce your body's production.
Huh. Never knew that. Okay, next section. Might be a bit sensitive for some. Pornography-induced ED.
Yeah, the source addresses this. The idea is overexposure to really high stimulation online content can desensitize the brain's reward pathways.
Making real-life intimacy seem less stimulating, less motivating.
Potentially, yes. And it stresses this isn't just a male issue, can affect women too. Risk increases with frequency, duration, type of content.
So how would someone know if this is affecting them?
For men, the source suggests a kind of self-check. Compare erection quality and time to orgasm when masturbating with your usual content versus without it, just using imagination.
And if there's a big difference, weaker erection or takes much longer without the visual aid.
The advice is to try stopping the adult content use for a while. Let the brain resensitize. It also specifically mentions things like flashlights.
Why those?
Because they can provide stimulation that's way beyond normal physiological levels, potentially worsening that desensitization.
Okay, makes sense. Let's talk about ejaculation.
Right. Afterwards, in men, there's detumescence, the erection subsiding. That's triggered by a sympathetic nervous system discharge.
The calm down signal after the event.
Basically, yeah. It causes muscles to contract, blood flow decreases. During the actual ejaculation, that bulbospongiosus muscle contracts strongly, rhythmically.
Accelerator.
Yeah, expels the semen. Then those pelvic floor muscles relax.
The source tackles that question about limits too, right? Like, is too much sex bad?
It does. It brings up the old Taoist idea about semen retention for vital energy.
And debunks it.
Pretty clearly. Says there's no biological basis for it, references historical texts, and basically states no amount of orgasm within reason is harmful.
Interesting. And it links less frequent ejaculation to a higher prostate cancer risk?
Some studies suggest that yes, physiologically, sperm that aren't ejaculated just get broken down and reabsorbed by the body. It even briefly explains vasectomy just blocks sperm release, doesn't change the semen otherwise.
Okay. Now for another potentially controversial one, squirting. What's the verdict here?
Based on the science presented in the source, anatomy, fluid analysis, it concludes it's most likely involuntary urine emission during sex.
Not from some special gland.
No known gland could produce that volume of fluid that quickly. Studies analyzing the fluid find markers of urine creatinine, urea, uric acid.
And ultrasounds show the bladder emptying.
There's evidence of that too, yeah. Other glands, like Bartholin's, produce lubricant, but at small amounts, gradually, not the same phenomenon.
Okay, so sticking to the science presented there, let's bring it all together then. A final recap.
Yeah, the core advice for improving erections, penile and clitoral, and overall satisfaction boils down to a few key areas.
First, reduce that sympathetic activity. Relax, rest, manage stress.
Second, empty the bladder and rectum before sex. Simple but effective.
Third, support blood flow. Boost nitric oxide through diet, maybe supplements. Aerobic exercise helps too.
Fourth, train those pelvic floor muscles. Kegels consistently helps trap the blood.
And finally, address any underlying causes. Health conditions, medications, lifestyle factors.
Yeah, look at the whole picture. By understanding these processes and applying these strategies, you really can positively impact your sexual health and enjoyment.
We definitely encourage you to explore these techniques, see what works for you.
Absolutely. Experiment safely.
And maybe a final thought to leave you with. Consider how much societal norms, maybe misinformation sometimes, shape how we even think about sexual function.
And how gaining a deeper, more accurate understanding of our own biology, like we've discussed today, how that might actually empower us towards greater well-being.
And maybe a more fulfilling sex life.
Yeah.
Something to mull over. Thanks for taking this deep dive with us.